Good morning. So, in the mechanism of drug action, already we have told there is a major target of the drugs are the receptor, ion channels, enzyme, and transporter. So, these are the things are the major targets, and how they are going to act, we are going to discuss in details. Of course, receptor we are going to discuss in the detail because we are going to study about the different types of the receptor. First, we'll talk about the enzyme. Now, enzymes are the one of the important target for the drug action. Of course, majority of the drug act on the receptor, but the enzyme also you can say that they are having important. They are considered as the important target for the drug action. Now, a drug can either increase or can decrease the rate of enzymatically mediated reactions. Now, what does it mean? After administration of the drug, the effect of the enzyme, the action of the enzyme can be increased or it can be decreased by the drug. That is important. Now, whenever we are talking about the increase or the decrease of the drug, a drug after administration can promote the enzyme action or a drug can inhibit the enzyme action. Now here we are going to discuss about the different types of the inhibition, decrease into the enzyme action. What are the different type of the enzyme action? Now here mainly we are going to discuss about the three different types of the uh, inhibition. Clear? Inhibition. What are the inhibition? Competitive inhibition, non-competitive inhibition, and uncompetitive inhibition. Now what does it mean? In the normal cases, this is the site. For example, this is the enzyme, this is the enzyme, and this is the substance. It is a drug. Consider it is a drug. So this substance, it will come and bind with this particular area. Whenever they will going to bind to this particular area, there is a activation of the enzyme. They will call the activation of the enzyme, or it may be the endogenous substance. When the endogenous substance it will bind to the enzyme, there is a call the activation of the enzyme. Clear? Activation of the enzyme. Now in the competitive inhibition, competitive means competitive, that is nothing but the competition. Clear? Competition between what? Competition between substrate and inhibitor. Substrate and inhibitor. Competitive in the substrate or among the inhibitor. That is also, it is also considered, we are considering this is a drug. Now whenever the competitive inhibitor come and bind here, the binding site is same for the both the inhibitor and the substance. The binding site is same. So whenever a competitive inhibitor will bind here, there is a no area that substance will be able to bind this enzyme, so there is a no activation of this enzyme. So that is we are calling as a competitive inhibition, because the that is substrate and competitive inhibitor are fighting to each other to bind that particular area. In case of the non-competitive inhibitor, in case of the non-competitive inhibitor, this inhibitor, that is non-competitive inhibitor, bind to the another side. The binding site for the substrate is free. The binding site for the substrate is free, but non-competitivity inhibitor, they are binding into the another side. But in that condition also, if the non-competitive inhibitor bind also, the enzyme it will not going to be activated. Clear? It is not going to be activated, because though their binding site is different, so they are the non-competition. There is a no you can say that scope of the competition. So the non-competitive inhibition. In case of the uncompetitive inhibition, though it is the rare, what happens? Say this is the uh, enzyme and substrate. Clear? Enzyme and substrate. So enzyme substrate complex. So here for example enzyme and substrate. So enzyme substrate complex. So this is the substrate, enzyme and substrate complex. After that inhibitor it will bind. So first the substrate it will bind to the enzyme, then the inhibitor come and bind to that, and then it will call the inhibition. Clear? It will call the inhibition. So that is the uncompetitive inhibition. First there is a complex formation between the enzyme and substrate, and after that there is inhibitor, it will come and bind and it will call the inhibition. So that is the uncompetitive inhibition. Now this is some of the example. Now competitive inhibition also, again we are further classifying two types, equilibrium and non-equilibrium. Now what you can say that equilibrium and non-equilibrium, what is the example? Like cholinesterase, clear, cholinesterase and acetylcholine, we know that that is cholinesterase is responsible for the breakdown of the acetylcholine, and physostigmine and neostigmine, it will cause the uh, inhibition of the cholinesterase, so the acetylcholine quantity is binding. But if you remember, so this what type of that, this is the cholinesterase inhibitor, clear, but this is the competitive or non, you can, sorry, this is the permanent binding or reversible binding or covalent binding. This is actually the reversible or irreversible is there, this is the irreversible. That means physostigmine bind to cholinesterase for a particular duration, but after that it will dissociate. Again, this enzyme it will be free. Where this enzyme it will be free. So this is the competitive type of inhibition. But if you remember about the drugs, those are the non-competitive anticholinesterase inhibitor like organophosphate. They will bind with the cholinesterase and covalently, clear, permanent bonding covalently, so it will not going to be dissociate. Therefore you can say that those type of the inhibition, it is called you can say that that is the non-competitive inhibition. They may cause the cytotoxic effect or the toxic effect. Non-competitive inhibitor, acetazolamide carbonic anhydrase inhibitor, so that is the non-competitive inhibitor. Aspirin, indomethacin, they are inhibiting the COX. Disulfam, aldehyde, dehydrogenase, so all those things are the example of the non-competitive inhibition. And placental derived alkaline phosphatase, that is the example of the uncompetitive inhibition. Now ion channel also considered as the important target for the drug. Of course, in the receptor also you are going to study about the ligand gated ion channel, but here we are specifically talking about the that is ion channels. It may be the sodium, it may be the calcium, etc. Like quinidine, they are inhibiting the sodium channel. Nifedipine, they are inhibiting the calcium channel. Ethosuximide, again the T type of the calcium channel into the thalamic neuron. If you consider about lignocaine, they are inhibiting the sodium channel. So these are the drugs act by the, you can say that either inhibiting or opening of the ion channels. Clear? Either opening or the inhibiting the ion channels. Next is transporter. Now in the transporter, these are the carrier molecule. Clear? This is the carrier molecule. In case of the absorption, we have discussed about the carrier molecule. Different carrier molecule, like we have told about the vitamin B12 transportation, it is occurs by a intrinsic factor. So you can say that, and in all the cases, see, as already you have studied about the different drugs already in your studied, so you can see that after whenever a neurotransmitter, it may be the acetylcholine, it may be the adrenaline, it may be the dopamine, etc. Whenever they are released into the synapse, after that some amount again it is going back to inside the neurons, clear, inside the neuron. So that is also one of the approach. Now like tricycling antidepressant, if you consider as a tricycling antidepressant, how they are inhibiting, they are inhibiting the reuptake of the noradrenaline and serotonin, also serotonin reuptake inhibitor also is there. So by the reuptake inhibitor means they are blocking the transporter who is responsible for their reuptake. So by this mechanism they are acting. So these are the some examples for the transporter block. So these are the different targets of drug.